The surge of new coronavirus infections is spreading wider and faster throughout the country. 29 states are reporting notable increases, many of those in the Sun Belt and the West. The head of the CDC also said today that it's believed that at least 23 million Americans have been infected. That's 10 times higher than the number of cases that have been reported. And the CDC added pregnant women to the list of high-risk groups. Amna Nawaz has a breakdown on these trends and the concerns over the pace of reopening.
Judy, Texas Governor Greg Abbott announced today he would pause reopening and free up more hospital beds as the state is struggling to contain outbreaks. In Florida, Governor Ron DeSantis urged older residents to stay at home and young residents to avoid crowds. But these governors and others have resisted new restrictions until now, and a number of states are now seeing record numbers of cases over the past week. To help us understand more about all of this, we're joined again by Dr. Ashish Jha, professor and director of Harvard University's Global Health Institute. Dr. Jha, welcome back to the NewsHour. And let's start with these numbers we're seeing, this surge in infections in a number of states. They have increased testing, many of these states, but what about reopening? What role did reopening play in contributing to those new numbers?
Yeah, so thank you for having me on. I think there's really little doubt that in many states across the country, we reopened too early. The evidence did not suggest that they were safe to reopen, and then they opened up too aggressively. And what we're seeing now is the surge in cases that unfortunately many of us worried about, and they're happening in large parts of the country. And it's really quite worrisome, and I think we have to act boldly to try to get this under control.
One of the questions people have, though, is that a number of states have been moving to reopen. We're seeing these huge surges in some states like Texas and Arizona and Florida, but we're not seeing them in other states that have also moved to reopen. So how do you reconcile that?
Yeah, so it's true that it's not happening everywhere in the country. Different states have taken different tactics in terms of how aggressively they've opened. Different states have taken different approaches in terms of how many cases they had when they reopened. And then there is always a little bit of idiosyncrasy to all of this. None of this is perfectly predictable. But that said, in my mind, there's no question about it that we're seeing large increases in infections, largely because we've opened up too quickly and too much.
I want to ask you, too, about the role of masks, because there's been a lot of conversation around this. And I want to share with you some analysis from state data that looks at the last 2 weeks in the states that recommend but don't require mask wearing. That was 16 states. New cases in the last 2 weeks went up 84%. And in other states, that's 11 states total, that mandated mask wearing in public, new cases fell 25%. So, Dr. Jha, those numbers are pretty striking, but we know there's a difference between causation and correlation. What can we say we know definitively about masks and their ability to stop the spread of the virus?
Yeah, so this is an area where the evidence really has shifted quite substantially over the last 2 months. And the study that you point to is only one data point. And if that was the only data point we had, I would say, well, that may not be that definitive. But as part of what are now dozens of studies that are coming out, I think we feel very confident that masks are a really important part of getting this virus under control. Unto itself, it's not enough, but as a part of a broader strategy, I think it's pretty critical that we get into mandatory mask wearing whenever people are out and about.
There are a lot of questions, though. People have concerns. You're seeing a number of these theories circulating on social media, too, that wearing a mask can actually be bad for your health. I've seen some of these where people say you can breathe back in the carbon dioxide you're breathing out, and that can be bad for your health. I've seen other theories where people say it can actually increase your chance of getting the virus if you wear a mask. What do you say to people who are reading those and are concerned?
So I understand the reason for concerns, but I think the evidence on this is pretty clear. Wearing a mask is not harmful. It's worth remembering doctors and nurses often wear masks for 12, 14, 16 hours a day. We haven't seen them get sick from wearing a mask. Other workers wear masks for long periods of time. Really, the concerns about breathing back in carbon dioxide or other things are not really rooted in medical science. And I understand it's a little bit inconvenient to be wearing a mask, but it's perfectly safe to be wearing a mask.
Let me bring you back to where we started the conversation with the news that the Texas governor says they're now going to pause reopening at this stage when they are amidst a huge surge in numbers. What kind of impact is a pause like that going to have? Is that enough to slow the spread?
So, I welcome the Texas governor recognizing that there is a problem, but this response is wholly inadequate for the size of the problem they have. By the time your hospitals are starting to get full, you've got 2 weeks of rising infections already baked in. Over the next 2 weeks, I expect the number of cases in Texas to continue climbing. And just putting a pause is not enough. They have to really think hard about mandated mask wearing. I think you have to pull back on large public gatherings. Really wonder whether it's safe to have indoor restaurants. There's a lot that the governor has to do to bring this virus under control. A pause is not enough.
Dr. Jha, we can't remind people enough that hundreds of Americans are still dying every day. When you look at the states where they are seeing these surges and increases, what steps could those governors take today that would help to slow the spread and prevent some of those deaths?
Yeah, so the single biggest thing that I think governors have to do is recognize how serious of a problem this is. And I still don't see that sense of urgency. We have to get ahead of this virus, and that means mandatory mask wearing. It means absolutely canceling any large indoor gatherings, including really rethinking things like restaurants, bars, nightclubs. And then we've got to keep working on ramping up testing and tracing. Even this week we heard from the president that the problem is we're testing too much. No, the problem is we're not testing enough. And we're not isolating cases once we find them. And so until we do those things, we're not going to be able to bring these large outbreaks under control.
That's Dr. Ashish Jha, director of Harvard's Global Health Institute. Thanks very much for joining us.
Thank you.